We talk about COVID care centers in Kannur. There are about 587 COVID care centers, and some of them are Deepthi Hostel, Arabic College, RFA Lodge, Mount Guide International School, Panoli Apartments, Wafi College, and ITM College. Let's move on to the programs and projects that were taken up by the district to slow down the spread of COVID. The first project that we will be talking about is the community project that aimed to beat COVID with isolation. Health authorities at the Iriveri Community Health Center in Kannur had launched a new project for the early detection of patients with COVID-19 symptoms to check the spread of the disease. Titled Let's Mew Up COVID-19, the project was envisaged with the realization that symptomatic patients constitute more than 90% of spreaders, and early identification of such persons would go a long way in containing the disease. At present, a person who develops fever would interact with family members before realizing that he was suffering from COVID-19. Then he would visit a clinic, causing the spread of disease there too. By the time the person is tested positive, the patient would have already become a super spreader. Under the project, a person who has symptoms such as fever, sore throat, or body pain is immediately shifted to a room or an isolation. After that, a healthcare worker will contact the person within 24 to 48 hours to record the detailed case history. They had ASHA workers, RRTS teachers, and Kudumbashree workers besides facilities for telemedicine. Selected taxi drivers were given training to take the patients to the health facilities. The next program that we will be talking about is the setting up of smart gates both in airports and the Kannur railway station. Smart gates are devices that can screen temperatures of passengers. It has the ability to scan groups of 10 people at the same time. And in case of emergencies, it can sound a siren to alert the officers. It also has the ability to recognize and record faces of passengers to help personnel collect information about the passengers. Next program was taken up by the district to deal with the mental health of children during lockdown. Kudumbashree Kannur District Mission had come up with Kalimuttam, an innovative program for ensuring the mental health of children. Kalimuttam is the program being implemented through Kudumbashree Bala Sabhas by the Kannur District Administration in the realization that their mental health needs to be improved. This comprehensive development program was being implemented by bringing together all the departments working in connection with child development under one roof. The program would be implemented through Kudumbashree Bala Sabhas in convergence with National Health Mission, Library Council, and ICDS. The Kalimuttam program aimed at the physical, social, and mental health development of children and was implemented in 4 levels such as NHG level, ADS level, Panchayat level, and state level. The locally selected resource persons would communicate with the children at Bala Sabhas on various topics. They would identify those children who were suffering from mental stress and ensure them the needed help under the leadership of the district mental health experts. Curriculum-related activities, co-curricular activities, personality development classes, activities to nurture social service attitude, arts, sports and cultural activities, farming activities, gender sensitization classes, etc. will also be implemented through this coordination program. The program also aimed at developing a referral system for the social mental support of the children, along with organizing productive and creative activities for children with their peers. By launching such a program associating with Kudumbashree Kannur District Mission, the Kannur District Administration had taken the upper hand in the development of the upcoming generation and for improving their mental health. The Kannur Kudumbashree district team was actively making effective interventions for implementing such an activity, converging with other governmental departments. All these activities of the program were being implemented following the COVID 19 protocol.
Lastly, let's talk about how COVID has affected the tourism industry in Kannur. The tourist inflow has come to a complete halt since January this year. The outbreak of COVID 19 has turned the life of businessmen upside down, taking away their entire income due to the precipitous drop in visitor arrivals. With their income disappearing, they were forced to sell their assets to clear up their EMI and even for their basic needs. And this economic crisis had even affected their mental health. This staggering collapse of the tourism industry is reflected on people's livelihood. Among them, the most affected are the stakeholders who shut down their ventures over the last 1 year. The impact of lockdown has been severe for homestays. Homestays survive on bookings by individuals and families who come to experience local life. So, with no tourists during the lockdown, there is no other revenue source for homestays, but they still hope for a road to recovery once vehicle movement is allowed. Moreover, it also has a positive impact on tourism. Kannur district was the first hotspot of virus transmission and the triple lockdown was implemented. Research have found that the quality of air had improved in the coastal areas of Kannur during the triple lockdown days. The concentration of carbon monoxide, sulfur dioxide, and ammonia were found to decrease significantly from pre lockdown days to triple lockdown days. The air quality index revealed that the air quality at the observational site was clean during the lockdown days.